Hi, my name is Christopher Hung, and I am a registered nurse in the Clemson program, RN to BSN. Today we have Matthew, who will be acting as my patient. We will start off with the assessment of the head, the neck, and the thyroid. So first thing we want to do as providers is introduce ourselves, provide privacy, make sure our hands are washed, provide some clean gloves, and go from there. So with my assessment, I'm going to assess and make sure that there's no lesions, no masses, make sure there's perfect symmetry. Make sure that there's no bruising. Go ahead and smile for me. And he's got a perfect smile. It is normal. It's symmetrical. With the palpation, we want to make sure that the temporal artery is felt. Go ahead and smile and chew. Good. And then as I move lower down with palpation, I can feel the transmandibular joint. He is moving it side to side. No crepitus is found or heard or felt. Next we want to do is assess the thyroid. We want to make sure that the trachea is symmetrical. We want to make sure that there's no deviation. Make sure that he's not in distress with his breathing. Can you take a deep breath with me? Good. Good. We want to get behind our patient. Go this way. And tilt the patient's head to the opposite side that we'll be palpating. So turn towards the right. Okay. And then bend your head down laterally. All right, take a swallow. Good. And then same thing on this side. Okay. Swallow. And then tilt your head down like that. Okay, swallow. Good, and it can be felt. After palpating, the next thing we want to do is listen. So we want to make sure if there's a bruit or if we hear anything suspicious that would warrant further testing. Listen here. Deep breath in. Good. Out. Good. Good. Now this would be the point where if we were suspicious of a stridor, this is where we would hear it in the trachea. And I do not hear a bruit. Typically a bruit would be heard if the thyroid was enlarged. So everything looks good, feels good, sounds good. Now we will move on to the cervical nodes and assess for the lymph nodes. The first lymph node on the list is going to be the preauricle, so that's going to be before the ear. And I'm not feeling any masses, nothing swollen. And then postauricle, which will be behind the ear. After the postauricle, I like to go to the occipital, behind the head. We're looking for a pea-size node. We're making sure that there's no tenderness, no pain, no swelling. Does any of that hurt?
No.
And while doing this, we want to ask our patient too if we're hurting them. Okay. After the occipital, we're going to move down to the submandibular, which is on the side of the jaw. Does that hurt?
No.
Above that is the tonsillar. Does that hurt?
No.
Submandibular is actually going to be right here below the jaw. Okay. And then we go to the submantle, which is right under the chin. Does that hurt? Good. Next, we're going to go to the superficial cervical, which is going to be right around here on the neck. Kind of do a hook shape right here. We do one at a time so we don't choke our patients. I'm not feeling anything swollen, nothing seems tender. And sometimes we may need to have our patient look to the side. Can you look to your left? And then this is the area of the deep cervical. Feel it right around here. Come around. Okay, turn towards your right. Feel that? Okay, and as we move further down, the supraclavicle is going to be right around here. I'm not feeling anything there. And then below that is the supraclavicle, right below the collarbone. So no inflammation, no tenderness. No pain?
Mm-mm.
Good. Those were the lymph nodes, the head assessment, and the thyroid assessment.